mental intelligence and mental illness. This is what we can say. And today there is a topic of
Hello, there is a lot of echo is coming.
Now is it fine, sir?
Yes, it's fine.
Um, that was from another device. Thank you so much for this, sir. Again, I would like to welcome all the eminent speakers to IDYM group of companies new series of mental illness. Yesterday we had a great discussion on mental illness. Now today we have the biological explanation of mental illness. So now when we mental illness, a brief my point of view I would like to present, that is the biological approach to the logical or psychopathical, you can say, belief that disorders can be organic or can be of physical cause or can be genetics. The focus of this approach is on the genetic neurological disorders or neurotransmitters or neuropsychiatrists, you can say, or neuroautonomy, or this list is endless and it can go on and on and on. So what happens here is the approach or the urge for this is for the disorder is to relate it. It's not only for the physical structure, it is to the functional development of the brain. So this debate, this topic is very vast to discuss on. And with this, I would like to, and I'm looking forward for exchanging different ideas and different perspectives of different point of views also from the eminent speakers today, present with me. So welcome everybody once again. And starting with today, I would like to invite our first speaker of the day is Raina ma'am. Is you are there? If you are there, good evening, namaste. Welcome to another series of mental illness and today's topic for biological approach for mental illness. Please take the center stage and you can go ahead with your speech, ma'am.
Good evening from Greece. It's a great pleasure and honor to be here today in this great event about mental health disorders. And I would like to congratulate IDYM on organizing every day amazing events, very enriching and resourceful for the audience. And I warmly thank Dr. Raviv Sankar for his always warm invitations. So mental disorders are increasingly understood in terms of biological mechanism. Diagnosing mental illness isn't like diagnosing other chronic diseases. I mean that classifying a mental illness is a more subjective and more complex issue. So we could say that the genetic, medical, and biological factors can play a major role in the development and progression of mental health disorders. Some mental health disorders can develop due to what we call biological mechanism, also known as biological risk factors. Biological risk factors for mental health disorders have to do with genetics, with the brain, with health habits also, with medical issues and pharmacology. And many medical illnesses like type 1 of diabetes have purely biological causes. Discoveries in the recent years about how the brain functions have provided biological explanations for various mental illnesses, thanks to new tools of neuroscience and advances in genetics and neuroimaging. Scientists are making progress towards deciphering the details of actually the underlying biology of mental disorders. Of course, yet experts don't agree on how far we can push all this biological model. However, mental illnesses can be genetic, which suggests that people who have a family member living with a mental illness may be more likely to develop one themselves. And research focuses on people, for instance, who have a strong genetic risk factor for schizophrenia, this example, with the goal of proving that intervention at an early stage may result in better treatment outcomes and potentially change the course of an illness. But the way these genes present themselves in each individual can be different due to unique irregularities of environmental factors. Because of this, a person can inherit a susceptibility to a mental illness, but not necessarily develop the illness itself. So there is an interaction of genetics and other factors that can influence or trigger an illness in a person who has inherited the susceptibility. Mental illnesses have been linked to irregular functioning on nerve cell circuits or pathways that connect to particular brain regions. And mental illnesses develop also when neurons in the brain stop communicating or where there is a problem with neurons communicating. We talk about illnesses that result from a chemical imbalance. And this chemical imbalance is studied in both people and animals. So certain neurotransmitters are known to play an important role in regulation of mood. For example, studies show that the brain has decreased amounts of neurotransmitters in depressed persons. So three neurotransmitters seem particularly important in depression, for example, norepinephrine, dopamine, which is very close to adrenaline, and serotonin. That's why the depressing drugs have very specific effects on these three neurotransmitters. Unfortunately, all the theories about the depressant function have big holes in them. I mean that when antidepressants are given to animals, the effects discussed that I mentioned before, these effects are produced in the brain within minutes or at most at a few hours. But antidepressants take weeks to work in human beings. So there is a lot of work to be done, and also there are many other chemicals that affect functioning of brain. That all these chemicals that have been found, and many more are believed to exist. So the majority of cases of depressive or manic depressive illnesses, for instance, appear to be genetically transmitted and chemically produced. In other terms, the disorders seem to be hereditary, and what is inherited is a tendency toward abnormal chemical functioning, what I said before, chemical imbalance in the brain. So antidepressant medications apparently have a compensating effect, correcting the imbalances that are believed to cause this depressive behavior. So we talk about hereditary factors, these patterns that can run in families. Suicide also has hereditary factors. For instance, we can see that in the course of their lives, brothers, sisters, parents, or children of a depressed person have a risk of approximately 20 to 25% of having this disease themselves. And this contrasts sharply with the brothers, sisters of a non-depressed person who have only 5 to 6% the possibility to have this disease. Although depressive illnesses do occur more frequently in particular families than the population at large, they do not always appear in families we predict they would, and sometimes they can skip generations. That's why we can say that heredity does not seem to be an all or none matter. The degree to which mood disorders occur in parents of children does not tell us whether nature or nurture is important. So whether mood disorders are caused by nature or nurture is of extreme importance, and over the years, geneticists studying psychiatric illnesses have tried to devise strategies to define the extent to which depression may be inherited, and one of the first methods used was a study of identical and fraternal twins. So not only are identical twins very similar physically, but they are very similar mentally. For example, identical twins who have been adopted by different families in early childhood grow up with intelligence levels that differ from each other only slightly less than those for identical twins raised together. This is important. And even if an illness is genetic, of course, as I said before, does not mean that other factors do not play a role in its development. The case of juvenile diabetes, when an identical twin has juvenile diabetes, in only 15% of the cases does the co-twin also have a disease. So there is an increasing evidence that biological depression and manic depression are often triggered by life events. Many psychiatrists, both past and present, have believed that depression was produced by life experience and was best treated by psychotherapy. We know the first that was most widely proponent of this view was Sigmund Freud, who began to theorize early in the 20th century about the causes of mental illness. And there are also the psychoanalytic theories of depression that have focused on an unexpressed and unconscious rage as a reaction to being helpless or dependent on other or to a loss of a loved one. And there are also the cognitive theories that, according to which patients with depression have developed depression because of errors of thinking. The errors of thinking are these unrealistic attitudes about themselves or the world, and could be how we undervalue ourselves, the low self-esteem, the negative view of our current experiences, and our pessimism, the belief that things will not improve. So depressed person feels depressed because he's constantly putting himself down. And the example of this attitude are, I will never get anything right, or every job is difficult for me. Apart from this, from genetics, there are also the case of infections. Certain infections have been linked to brain damage and development of mental illnesses, brain defects or injuries, prenatal damage, substance abuse, and other factors. And before concluding, I would say that from an evolutionary perspective, the biology of mental disorders is not just neurobiology and genetic constitution, but also adaptive reactions to adverse situations. That's why we need to adopt always a holistic approach. And that's why we need to have in mind the combination of various factors at the same time. Thank you very much for your attention.
Thank you so much, Raina. There's one little question which I would like to ask you. Of your speech, it was wonderful. I have gained so much of knowledge due to that. You have, said that these are genetics. Maximum time, the biological, illness is maximally genetics. So, how do certain people get depression with situation, with age? So, do we consider that as a disease or a disorder?
Is what I said before, that although there are hereditary and genetic factors for this, and antidepressant medicaments are also targeted at this point at these factors, all of the new research focus on multiple factors at the same time. I mean, but that could be a lifetime experience, that could be a traumatic experience, or a sociological impact. So that's why the treatment now could not be based on pharmacology. Pharmacology is only for biological factors. The treatment of mental disorders, it's a very, very complex issue. And I have many persons in my family environment who suffer from mental health disorders many, many years now. It cannot be treated well with pharmacology. So since there's this new research data that we have, that we need to take into consideration all these complex factors that at the same time can interact. You can have at the same time genetics, at the same time a traumatic event in your life. All these factors should be taken into consideration. So psychotherapy, psychology, and medicine should interact at the same time. This is my opinion. As far as my experience with my close friends shows me.
Thank you so much, Raina ma'am. It was wonderful. And we need to be more human while considering these things and talking to people who are suffering from that. It can be genetic, biological, or environmental, as you said. And what I really liked about your speech was brain functionality, which we usually overlook it. We don't focus on that. The brain function is the main cause of mental illness, where there are n number of factors which are neurological, basically factors which are affecting the mental illness. So again, Madam, one last thing before you go. Is there anything that you would like to speak to our young generation, giving, because they are the people who are being bullied a lot, who are being going to mental stress a lot, and they are facing a lot of anxiety, depression, or name it anything that they are going through, that especially from the teenagers from 16 years onwards.
Mhm.
Those are the
Look,
young
during the COVID pandemic, when this started, the outbreak of the pandemic, and we have seen all the reports of United Nations and UNESCO about the dramatic rise of mental health rates, especially among young people. Then I wrote an article in the National Magazine. It was actually teaching using the brain-based strategies, using principles of neuroeducation, because actually I'm a neuroeducation researcher. It had a great impact all over the world. It was original then, it was written in 2020. It is actually an educator, a guide to educators about how to cope with the challenge of the COVID pandemic using these brain-based strategies in the classroom, especially during online learning. Online learning is, very boring and difficult to handle for children. So there I suggest that it's important to create positive emotions, first of all, because emotion is closely related to learning. Everything we think and all our thoughts and feelings are shaped by emotion and our states of mind. And we know also the role of amygdala. Amygdala is the region in the brain which is related and linked with fear. So this region was highly activated during the COVID pandemic, because we all know that how we were afraid of getting infected, etc. So our activities should target at first how to mitigate the impact of amygdala. Create positive emotions. The second one is collaboration. You can tell me how you can foster interaction skills during social distancing. Social distancing is only physical. It shouldn't lead to isolation. I was telling always to educators that we have many collaborative platforms. We have blogs, we have wikis, we have a Zoom, so many platforms that we can use even during online learning in order to make our students collaborate themselves and to foster their interaction abilities. And apart from this, what I did as educator is to help my students express themselves, to encourage them to express their feelings and experiences about the pandemic, because this is cathartic. And the role of arts is also cathartic. In neuroeducation, there is a whole chapter which explains why arts should be integrated as a brain strategy in the classroom. It's very cathartic, and it helps children express themselves and feel very relieved. Help themselves express, help them students express themselves, encourage collaborative projects, and the role of safety. We need to secure our students that are safe, because our brain needs security. Our brain needs to bring an order into the chaos. It needs to classify information. And above all, it's the most appropriate methodology for any mental health disorder is to take into consideration the interest of the person we have, the age he needs, his past life events. There is no one recipe. I always adopt eclectic methods that can use principles for various methodological theories. But apart from this, we also need to take consideration that each individual is unique, each brain is unique. So we need to respect its individuality and adopt our methodology according to this uniqueness.
Thank you so much for your wonderful outputs. I hope everybody has learned, including me, today a lot. Thank you so much for your time and giving up the wonderful inputs on the biological explanation of mental illness, because many of the people are not aware of the biological explanations for that. Thank you so much, ma'am. With this, I would like to invite a second speaker for the day, Dr. Pratik. If you are available, can you just please come up and take the center stage, sir?
Yes. Okay. Am I audible?
Yes, sir. And it's very nice to see you after a very long time. So, really honored to have you, sir. Please, stage is yours.
Yes, yes, sure. So Rani has explained very well about the mental illness, the neuroscience perspective, neuroscience perspective. So now I would like to throw some light on what are the causes of mental illness and disorders. Okay, so although the exact cause of most mental illnesses is not known, it is becoming clear through research that many of these conditions are caused by a combination of biological, psychological, and environmental factors. So, what biological factors are involved in mental illness? So, some mental illnesses have been linked to abnormal functioning of nerve cell circuits. Okay, or you can say pathways that connect particular brain regions. Nerve cells within this brain circuits communicate through chemicals called neurotransmitters. Okay, tweaking. So these chemicals, through medicines, psychotherapy, or other medical procedures, can help brain circuits run more efficiently. And in addition, defects in or injury to certain areas of the brain have also been linked to some mental conditions. So, other biological factors, this is one of the factors. And other biological factors, they may be involved in the development of mental illnesses, including, first is genetics, which is heredity. So mental illnesses sometimes run in families, suggesting that people who have a family member with a mental illness may be somewhat more likely to develop one themselves. So susceptibility is passed on in families through genes. Experts believe many mental illnesses are linked to abnormalities in many genes rather than just one or a few, and that how these genes interact with the environment is unique for every person, every identical twins. And that is why a person inherits a susceptibility to a mental illness and doesn't necessarily develop the illness. So mental illness itself occurs from the interaction of multiple genes and other factors such as stress, abuse, or a traumatic event, which can influence or trigger an illness in a person who has an inherited susceptibility to it. So this is about genetics. Next is infections. So certain infections have been linked to brain damage and the development of mental illness or the worsening of its symptoms. For example, a condition known as pediatric autoimmune neuropsychiatric disorder, which is we say in biological term PANDAS, PANDAS. So pediatric autoimmune neuropsychiatric disorder. So this associated with a streptococcus bacteria and has been linked to the development of obsessive compulsive disorder and other mental illnesses in children. So this is example of infection. Sorry to say, but I'm talking as I'm biotechnology. I'm a biotech engineer, so I'm going into much details. Next is brain defects or injury. Defects in or injury to certain areas of the brain have also been linked to some mental illnesses. Then comes parental damage. Prenatal damage. So some evidence suggests that a disruption of early fetal brain development or trauma that occurs at the time of birth, for example, loss of oxygen to the brain, may be a factor in the development of certain conditions such as autism spectrum disorder and substance abuse. The long-term substance abuse in particular has been linked to anxiety, depression, and paranoia. So these are the damages. Then other factors are also there, like poor nutrition and exposure to toxins such as lead may play a role in the development of mental illnesses. Now the biology, I can say, behind these mental illnesses. So as with many chronic diseases, mental illnesses are biological based, as I explained earlier also. So in addition, there are physical, social, and environmental factors that can play a role in their development. A mental illness is nothing to be ashamed of, as it is a medical problem, and just like heart disease or diabetes. So offering education about the biological basis of mental health disorders can lead to a greater understanding and acceptance, and help those with mental health concerns to feel less ashamed of their disorders. Now, there are, a mental disorder. What is mental disorder? So a mental disorder is characterized by a clinically significant disturbance in an individual's cognition, emotional regulation, or behavior. It is, usually associated with distress or impairment in important areas of functioning. So there are many different types of mental disorders. Mental disorders may also be referred to as mental health conditions. So the latter is a broader term covering mental disorders, psychosocial disabilities, and other mental states associated with significant distress, impairment in functioning, or risk of self-harm. So, I'm going to focusing on now mental disorders, as described by the International Classification of Diseases. So, in recent research in 2020, 1 in every 8 people, or 970 million people around the world, were living with a mental disorder, with anxiety and depressive disorders the most common. So in 2021, the number of people living with anxiety and depressive disorders rose significantly because of the COVID-19 pandemic. And initial estimates show a 26% and 28% increase respectively for anxiety and major depressive disorders in just 1 year. While effective prevention and treatment options exist, most people with mental disorders do not have access to effective care. Many people also experience stigma, discrimination, and violations of human rights. So, anxiety disorders. What are these disorders? So in 2020 or 2021, 301 million people were living with an anxiety disorder, including 58 million children and adolescents. So anxiety disorders are characterized by excessive fear and worry and related behavioral disturbances. So symptoms are severe enough to result in significant distress or significant impairment in function. So these are several different kinds of anxiety disorders, such as generalized, anxiety disorders characterized by excessive worry, panic disorders characterized by panic attacks, social anxiety disorders characterized by excessive fear and worry in social situations. Then separation anxiety disorders characterized by excessive fear or anxiety about separation from those individuals to whom the person has a deep emotional bond, and others. There are many disorders. So effective psychological treatment exists, and depending on the age and severity, medication may also be considered. Now, next is depression. Very well known type of disorder, and there are so many facts about this depression. And in 2020, 280 million people were living with depression, including 23 million children and adolescents. So depression is different from usual mood fluctuations and short-lived emotional responses to challenges in everyday life. So during a depressive episode, the person experiences depressed mood. You may be feeling sad, irritable, empty, or a loss of pleasure, or interest in, and a loss of interest in activities. So for most of the day, nearly every day, for at least 2 weeks, several other symptoms are also present, which may include poor concentration, feelings of excessive guilt or low self-worth, hopelessness about the future, thoughts about dying or suicide, disrupted sleep, changes in appetite or weight, and feeling especially tired or low in energy. These are the symptoms of this depression. So people with depression are at an increased risk of suicide. Yet, effective psychological treatment exists, and depending on the age and severity, medication may also be considered. Next is bipolar disorder. 40 million people experience bipolar disorder. People with bipolar disorder experience alternating depressive episodes with periods of many symptoms. So during a depressive episode, the person experiences depressed mood, feeling sad, irritable, empty, or loss of pleasure or interest in activities, as I told you in depression. The same, there are some symptoms which are repeating in this bipolar disorder. So for most of the day, nearly every day, many symptoms may include euphoria or irritability, increased activity or energy, and other symptoms such as increased, talkativeness, racing thoughts, increased self-esteem, decreased need for sleep, distractibility, and impulsive reckless behavior. So these kind of people with bipolar disorders are at an increased risk of suicide. And there are so many treatment options exist, including psychoeducation, reduction of stress, and strengthening of social functioning and medication, of course. Next is PTSD. So what is PTSD? PTSD is post-traumatic stress disorder. So the prevalence of PTSD and the other mental disorders is high in conflict affected settings. So PTSD may develop, exposure to an extremely threatening or horrific event or series of events. So it is characterized by all, re-experiencing the traumatic events or events in the present. So intrusive memories, flashbacks or nightmares, then avoidance of thoughts and memories of the events, or avoidance of activities, situations, or people with reminiscent of the event, and persistent perceptions of heightened current rate. So these kind of symptoms persist for at least several weeks and cause significant impairment in functioning. Okay, so there are effective psychological treatment exists for this PTSD, post-traumatic stress disorder. Next is schizophrenia. So schizophrenia affects approximately 24 million people, or 1 in 300 people worldwide. So people with schizophrenia have a life expectancy 10 to 20 years below that the general population. Schizophrenia is characterized by significant impairment in perception and changes in behavior. So symptoms, may include persistent delusions or extreme agitation. The people with schizophrenia may experience persistent difficulties with their cognitive functioning. Yet, a range of effective treatment options exist, including medication, psychoeducation, then, family interventions, and psychosocial rehabilitation. So these all the, medications or treatment available for schizophrenia. Next is eating disorders. In recent 2021, 14 million people experience eating disorders, including almost 3 million children and adolescents. So eating disorders such as, anorexia nervosa and bulimia nervosa, these are the disorders. They involve abnormal eating and, preoccupation with food, as well as prominent body weight and shape concerns. So the symptoms or behaviors results in significant risk or damage to health, significant distress, or significant impairment of functioning. So anorexia nervosa often has its onset during adolescence or early adulthood and is associated with premature death due to medical complications or suicide. Individuals with bulimia nervosa are at significantly increased risk of substance use, suicidality, and health complications. So, for these also effective treatment options exist, including, family-based treatment and cognitive-based therapy. Next is disruptive behavior and dissocial disorders. So 40 million people, including children and adolescents, were living with conduct dissocial disorder. So this disorder, also known as disruptive or you can say conduct disorder, is one of the two disruptive behavior and dissocial disorders, and the other is oppositional defiant disorder. So disruptive disorder and dissocial disorder are characterized by persistent behavior problems such as persistently defiant or disobedient to behaviors that persistently violate the basic rights of others or measure age appropriate societal norms, rules, or laws. So onset of disruptive and dissocial disorder is commonly, though not always, during childhood. For this also psychological treatment exists, often involving parents, then caregivers and teachers, cognitive problem solving or social skill trainings. Then comes neurodevelopmental disorders. So Rani has talked about this. So neurodevelopmental disorders are behavioral and cognitive disorders, and that arise during the developmental period and involve significant difficulties in the acquisition and execution of specific intellectual, motor, language, or social functions. So neurodevelopmental disorders include disorders of intellectual development, autism spectrum disorder, and attention deficit hyperactivity disorder, which is ADHD, amongst others. So the ADHD, which is affection deficit hyperactivity disorder, is characterized by a persistent pattern of inattention and or hyperactivity impulsivity that has a direct negative impact on academic, occupational, or social functioning. So disorders of intellectual development are characterized by significant limitations in intellectual functioning and adaptive behavior, which refers to the difficulties with everyday conceptual, social, and practical skills that are performed in daily life. Next come ASD. ASD is autism spectrum disorder. Constitutes a diverse group of conditions characterized by some degree of difficulty with social communication and reciprocal social interaction, as well as persistent, restricted, repetitive, and inflexible patterns of behaviors, interests, or activities. So there, for these two diseases, effective treatment options exist, including psychosocial interventions, behavioral interventions, occupational and speech therapy for certain diagnoses and age groups. Medication may also be considered. So now, so this is about causes and disorders of this mental illness. So now, who is at risk for developing a mental disorder? So at any one time, a diverse set of individual, family, community, and structural factors may combine to protect or undermine mental health. Although most people are resilient, people who are exposed to adverse circumstances, including poverty, violence, disability, and inequality, are at higher risk. So protective and risk factor, including individual psychological and biological factors such as emotional skills as well as genetics. So many of the risk and protective factors are influenced through changes in brain structure and or in function. Now, health systems and social support. So health systems have not yet adequately responded to the needs of people with mental disorders and are significantly under-resourced. So the gap between the need for treatment and its provision is wide all over the world and is often poor in quality when delivered. For example, only 29% of people with psychosis and only 1/3 of the people with depression receive formal mental health care. So people with mental health disorders also require social support, including support in developing and maintaining personal, family, and social relationships. So people with mental disorders may also need support for educational programs, employment, housing, and participation in other meaningful activities. So with this, I think I have covered causes and disorders regarding this mental illness. And once again, thank you so much for organizing back to back after NEP this mental illness conference. So hats off, kudos to Ravi Shankar sir and the entire team of our IDYM. Thank you so much.
Thank you so much, Pratik sir, for interpreting so depth about mental illness and covering every single aspect of that, wherein you have spoken about ADHD or anything, even starting from genetics to the ADHD point of view. And to be very frank, 43.29% of the worldwide generation today is facing this mental illness, and this is really very important for us to have knowledge and impart knowledge. And I'm really glad to be a part of this series where I am gaining so much of knowledge and people are gaining so much of knowledge with this. And I heartily thank you so much for taking out time and sharing knowledge with us. Sir, only one question before you go. You have said this. We are discussing on the biological aspect of mental illness, but it's always the left side of the brain which doesn't have function properly. That is why the mental illness happens. This is what the studies show. And in the journals also, it's been written when the left side of the brain is not fully developed, or due to stress or anxiety or in any name anything that this illness happens. So do you consider this as a disorder or disease? Because certain times it can be curable. So what are your views on this?
Disorder, basically. It's not a disease. It is disorder. For this, I would like to explain with the help of neuroscience. So neuroscience and brain imaging technology. So neuroscience is advancing. And thanks to deeper understanding of genomics, there are lots of biomarkers. I have done my PhD in biomarkers. The cancer treatment. Biomarkers are what? Biomarkers are like enzymes, which are very specific in their action, and that is they target this means and this, and bring about a chemical change. So this is about biomarkers. For so many diseases, I'll come later on the disorder aspect, but diseases like cancer, we are. Thanks to biotechnology, there are a lot of advancement, and biomarkers are inventing. Our scientists and my fellow, friends are inventing. The cancer in India for cancer. Chemotherapy is very well known, but there are so many disadvantages of chemotherapy. Hair fall, and if the person is less immune, he or she can may lead to severe other diseases, or he or she may die. Okay, but there are so many non-invasive imaging tools also. There is an impressive and growing suite of technologies to study the structure and function of large-scale brain circuitry with a real accuracy and precision. So these kind of technologies are rapidly changing the way we think about, study, and approach the development of new treatment. For example, thanks to this brain imaging technology, there has been a drastic increase in knowledge about normal brain function and how mental illnesses can impact the brain. So mental illnesses have been linked to irregular functioning of nerve cell circuits or pathways that connect particular brain regions. There are discoveries in recent years about how the brain functions have provided biological explanations for various mental illnesses, and imaging studies have revealed that the longer you live with depression or, as I said earlier, schizophrenia, the more damage it does to the brain. And in fact, this imaging has shown that parts of the brain shrink with lengthy or repeat episodes. So additionally, the neurotransmitters are naturally occurring brain chemicals, and that carries signals to other parts of your brain and body. And these develop, mental illnesses develop when neurons in the brain stop communicating, and when there is a problem with nervous communicating. So, these discoveries reinforce the idea that someone with a mental illness should be treated no differently than someone struggling with another serious illness, or you can say disease. So that's why I say this is disorder. I hope
because many of the people, they are not aware about the basic difference between disorder and disease. So they get confused into that. So every time if certain person is having a disorder, they believe that is a disease. So the total aspect of seeing the problem changes. So at the point of view to look to the person, if I say I have a disorder, so if suppose for an example, I have an ADHD, they'll believe that as if I am having a disease. So the aspect of seeing me and treating me is totally different. That is why I asked you the question to bring this viewpoint to the people who are watching at least
That's
the light.
why I can and I congratulate, Ravi sir and the entire organizing team for organizing such, diverse topic. And this kind of topic needs awareness. Okay, there are a lot of people who don't know, they don't know about, the basic difference between disorder and disease. Okay, so through this conference, many speakers will share, their thoughts on, and clear all those confusions between these, this kind of mental illnesses or with associated things. So once again, thank you so much.
Thank you so much, Pratik sir, for taking out time and enriching us with so much of knowledge, which was really required. And the basic thing which I was really looking for was the difference between disorder and disease. So this is the basic thing as human we need to know and we need to learn about that. So thank you for bringing up that point and making aware people of that. So thank you so much, Pratik sir, for coming up and joining today and imparting so much of knowledge on biological illness and of biological explanation of mental illness. Thank you so much, Pratik sir. Thank you once again. So with this, I would like to invite my next guest speaker for the day, Dr. Anjum. If you are there, please can you just please take up the stage?
Yes, ma'am. I'm audible?
Yes, ma'am. Can you?
Okay.
Please put on your video, ma'am, if it's possible, ma'am.
Ma'am, it's not possible. I'm not well, so I just don't want to start the video. I'll just share the screen.
Ma'am, please go ahead. Stage is yours.
Okay. My screen. Oh. Just a minute, ma'am. Just a minute. I'm sharing the screen.
Ma'am, can you just make it as a full PPT mode, ma'am, please?
Is it okay now?
It's not showing the full PPT mode. Press F5.
Hello, Anju, ma'am. Hello, can you hear me?
Yeah, ma'am.
Please press F5. F5. It will direct you to the first slide. Okay.
Now is it okay?
No, but not the
Yes,
first slide.
Yes, it's fine. Yes, Imam, ma'am, it's the full screen.
Full screen, but not the first.
Yeah. F5, ma'am. Please press F5.
No, on my screen, I can see it in the full screen on my laptop.
Okay, full screen, but not the first slide, my dear sister. So please go to the first slide, the cover. By F5 or any way, but we need you to be at the first slide. Can you hear me?
Yeah, ma'am. I'm able to hear you.
Okay. Take your time. Yes.
Just a minute. I think
we are waiting. Take your time. Thank you, Meenakshi. Thank you.
Yeah. So now let's start. Good evening, everyone. I'm Anjum Qureshi, and I'm here to speak on the topic of mental illness. It's again a mental illness. I thought I should be. I would like to thank IDYM for such a diverse topic. Now it has become the need of our, because mental health among the youth, especially mental health among the youth, has taken a toll today. If you look at the graph of the people there which are affected from the mental illness, we can see more number of youth, especially between the age of 15 to 29 years, who are suffering from some kind of mental illness. Now, why do we need to actually address the mental health? Because physical health is somewhere given more importance, and the physical or the critical illness is always discussed. A person will say openly that he is suffering from some kind of illness, like he's suffering from blood pressure or diabetes or cancer or some kidney ailments. But people hesitate to speak about the mental condition. They hesitate to admit that they are suffering from some kind of mental ailments. And moreover, there is lack of awareness among the people that they are not able to recognize that they are suffering from some kind of mental disorder. The people don't discuss it, they don't, and they avoid taking medical help. And even if they are suggested that according to your history, according to your medical history, you should refer to a psychiatrist or you should go to a clinical psychologist, the people hesitate to do so. And due to this, what happens is most of the mental issues are never solved. And still in India, there are millions of people and millions of youth who need intervention for the mental illness, as suicide rate is very high. Now, the areas of concern for youth. Now, these are the few areas of concern, the peer pressure, because the peer pressure plays a very important role because it is due to the peer pressure.
Anju, mom, so sorry, full screen again, please. Yes, you can move by up and down also at the same time of doing a full screen.
Yeah,
So
now
no need to return. Yes, it's okay now.
Yeah.
But don't leave full screen, please.
Yeah. I think
Thank you.
it was my mistake.
Thank you. Don't worry.
Yeah.
Yes.
So these are the few areas of concern for the youth. First is the peer pressure, because all the kind of, especially the bad habits that the youths develop are due to the peer pressure. And the second, the addictions, the drugs, smoking and alcohol, which is prevalent among the youth. And if you look at the youth of the, especially the colleges, the higher education institutions, more than 90% of the youth are following this. And the third is the unemployment. And the fourth and the most important one is the social media influence, because everyone has a smartphone with the internet in their hand. They're spending so much of time on the social media, viewing the YouTube videos, playing online games, online shopping, and moreover, they are being influenced by the information that is being passed to them through the social media. Without knowing the authenticity of it, without checking the authenticity of it, they live with that information and they are passing it. The fifth one is the physical, emotional, and sexual abuse, which is again becoming more prevalent among the youth. And the most of the victims in this case, are the women or the young girls. And yes, the love failures, broken relationships. So these are the few areas of concern, because I thought I should be just mentioning this, because these are some daily activities that are going on, which is somewhere influencing the youth. And if these activities are not controlled, the youth will very quickly, they will go develop mental health issues. Now, some of the mental health issues that are being observed are depression, anxiety, sleep disorders, hyperactivity, aggressive behavior, loneliness, criminal tendencies, and suicidal tendencies. Loneliness now, it is again growing very much in the youth. They are surrounded by people, they are surrounded by their friends, their classmates, teachers, but still they have a feeling that there is no one to hear them, there is no one to look after them. And criminal tendencies, it is again increasing. If you just look at the newspapers nowadays, you can find a number of youth that are involved in some or the other kind of crimes, whether it is theft, whether it is robbery, whether it is murders. And even you can see such news where the youth are harming their parents. Leave aside the other people, they are harming their parents because their parents have refused them to use the mobile phone or play the online games. And when the above mentioned mental health issues are not addressed, are not paid attention, they take the ultimate step, that is the suicidal tendencies. After the road accidents that are being caused due to different reasons, suicide still remains the second most important cause of death, the second most cause of unnatural death among the youths. Now, why this is happening? Why the mental illness is increasing? Firstly, to the change and busy lifestyle that we are having nowadays. Due to the globalization, many people are shifting towards big cities or the metro cities, and even sometimes to other countries for getting better opportunities for higher studies or for some better job opportunities or career opportunities. In this process, what is happening is they are leaving their elders, they are leaving their grandparents at their own home. And due to this, the knowledge that our elders had, the moral values, the ethics, the family traditions, the religious beliefs, they are all not passed from one generation to the other. They are not being passed to the next generation. And there is lack of trust among the people. There is social interaction has actually reduced among the among the people. And especially when both the parents are working in cities, if you see in most of the families, both the parents are working, so they are being left to the maid or the caretaker. So in this condition, sometimes it is not possible to give that sanskars, to give that ethics to the children. Now, well, when you work, when you get better job opportunities, you can fulfill the needs of food, clothes, and education. But what about the spiritual, emotional, and the mental needs? When you don't eat food properly, you get malnourished. Well, malnourishment at the physical level is visible, but not for the mental, spiritual, and emotional level. At the genetic level, we have like few limitations for our physical appearance. Like we tend our physical appearance, like our height, our skin color, or your hairs, they are mostly we resemble it to the parents. But there is a lot that can be done at the development of the mental level. There is a lot that can be done at the development of the spiritual level. But here, what is happening is somewhere we have this forgotten to weigh the things, to decide what is major and what is minor for us. We are wasting the major time, energy, and money on minor things. Like nowadays, the youth are wasting most of their time, a major part of their time on the social media, on the internet, without worrying about their studies, without thinking of their career development. They are wasting their time on the different kind of addictions. The people are worried more about their physical appearance. Well, looking good is it's not so bad. Well, you should dress you should dress good, you should look good, but more than the physical appearance, the youth should actually strengthen the spiritual and the moral values. That is more required. Now, coming to the biology of the mental health, the technological advancements that have been taking place in the world. Now the technology is changing at such a faster rate. Now, with the help of the technologies, the researchers are able to develop an interactive model of the brain. Research has also helped to study the complicated communication system. Why I call brain as a complicated communication system? Because it consists of so many neurons, so many cells, and how the interaction is going on between the cells, how the brain is storing the information, processing the information, and passing the information from one cell to the other. It is a very immense area of study. And research actually it helps to know about the conditions that leads to the symptoms of mental illness. And there are actually a lot of biological as well as the chemical brain changes that contribute to mental health. Now, here I would like to discuss in short about the neurotransmitters. The neurotransmitters are the chemicals that transmit messages between the cells, between the neurons. And actually, the type of neurons in the part, which is called as the synapses, it affects the transmitting and the receiving of the messages. If and it impacts the thinking, behavior, and feelings of a person. So the symptoms of mental illness are developed when the amount of neurotransmitters is above or below the threshold levels that are actually either or above the permissible levels or the desired levels, and they are not absorbed properly. Now, what the impact of neurotransmitters? So there are basically 4 types of neurotransmitters: dopamine, serotonin, norepinephrine, and gamma-butyric acid. The serotonin neurotransmitters are involved with the symptoms of depression. Is the people who experience depression, they are due to malfunctioning of the serotonin. And similarly, psychosis, when the dopamine is not working properly, such people may develop psychosis. And technology also tells that there are changes in the brain for the people who develop mental illness. The limbic, for example, the limbic system, which is the area deep inside the brain, it controls the emotions and drives. And when the physical changes are actually seen in these areas with the people who develop mental illness. And similarly for the amygdala, in the amygdala, which is actually the center for emotionally charged memories. So the higher blood flow and glucose metabolism is found in amygdala in people with depressive disorder and bipolar disorder, and it causes exaggerated emotions and moodiness. And similarly, when amygdala when overactivated and the prefrontal cortex over the amygdala is weakened in anxiety disorder and obsessive compulsive disorder. Now, in schizophrenia, this is again another mental disorder which has disturbed the people. So in this, abnormal brain waves are produced and it interferes the ability to process information. The brain is unable to tone down external sounds and screen out the unwanted noise. And the study of the scans for the patient with schizophrenia, it says that it shows that there is shrinking of gray matter in the young adults who develop this kind of disorder. Well, at the beginning, the loss may be less than 10% in the parietal lobe, and it increases throughout the brain in few years. And with the increase in tissue loss, the people experience depressions, disturbed thoughts, psychotic thoughts, and hallucinations. So the other question arises, when such kind of mental ailments are there, are they curable? Is treatment possible for it? Yes, treatment is possible, but it takes time. Actually, the time required for the treatment, it depends upon the level of mental illness or the mental disorder the patient is suffering from. At the initial stage, if these ailments are detected, it can be done with counseling. Then it requires medicine, and the amount of medicines and the types of medicines that a patient has to take, it may vary from a person to person. Now, there are, with the advancement of technology, there are a number of scanning methods, and with the help of scanning method, it has become easier for the radiologists to study, and the neurologists to actually study the pattern of the brain. For example, the positron emission tomography, it uses a radioactive substance to detect diseases or injury. And when this this kind of imaging techniques are combined with some modern technologies like the machine learning, deep learning, artificial intelligence, and swarm intelligence, it becomes easier for the doctors to study the conditions of the patient. Now, as it is said, as you saw, yes, this disorders can be cured. So, as we say, prevention is better than cure. So how it can be prevented? These ailments can be actually prevented if we become mentally stronger. Yes, it's not that we can't live a life without stress and without challenges. We need stress and we need challenges to become stronger. But once the limits are crossed, we become weaker. And mental wellness means to make our moral fabric strong enough to handle all the ups and downs in lives. Now, what is the primary cause of mental illness? It is the polarization between the heart and mind. And when this polarization increases, the difference between the person starts increasing. For this, you need to actually develop a great level of understanding. You need to develop a right thinking process, and you need to study the process from all angles. For example, if you had a conflict with your colleague or your relative or your friend, so instead of reacting at that particular moment, it will be good to actually postpone your reactions. You can postpone your anger, give time for introspection. And if at the end of the day you find, yes, you were wrong, then don't hesitate to apologize. Well, this conflict and the misunderstanding, they arise due to the mismatching of feelings of heart and the thoughts of minds. And when the people feel all holes are crashing, there is nothing left with them. They take the ultimate step of suicide. Like we take vaccination to immunize ourselves. Similarly, we need to actually address and fabricate the mental health to remain mentally strong. And as coming again back, I was talking about youth. So now here, when the youth are leading their lives, they actually feel something is lacking, but they are not able to find out what actually they are lacking. And for the inner hunger, to fulfill the inner hunger, it needs to be calm and peaceful. Because once you are calm and peaceful, once you are driven by the inner voice, the success will await you. If you're not voice, any kind of brilliant ideas you have, you can't be successful. All the ideas will fail because you're restless. When you go out in the community, you don't have a peace of mind. If you don't have peace of heart, you can't be successful. So it's necessary that you come at a peaceful stage. You have to, as you make choices for your healthy body, you have to make choices for your healthy mind. You have to be aware that the mental health needs attention. Now, in this, the parents have a very important role to play. We very well know that the children don't listen to the parents many times, but they actually try to copy, they actually try to follow what the parents have been doing. So the parents have to actually show sympathy, they have to shower more of love on them. And like nowadays we have the culture where both the parents are working, so it is required that the parents maintain a difference between their personal and professional lives. They give time to their children, and like develop the habit of prayer. And one more important thing that always when which I keep on telling my parents are your best friends. And this is something even which we parents should understand, that we have to be their best friend, because a best friend is one who is your greatest, who is the first one to appreciate you, and at the same time he is there to criticize you when you're going wrong. So we parents have to be the best friends of your children. And when the children are actually raised by responsive parents, they have better emotional and mental development. Now, as the youngsters and the children, they spend most of their time in their school. So the teachers and the schools, they also have a very important role to play in dealing with the mental disorders. Now, firstly, the teachers, whether they are in school or in colleges, they should be given training on the psychology of the children or the psychology of the youngsters and the mental health. There should be counseling sessions regularly and the schools and colleges, and also some short films, documentaries on mental health should be shown to the children. Now, secondly, the teachers should keep on managing the teachers. Okay, they are responsible for monitoring the academic performance, but they should also monitor the behavior of the student. If they find a student who is very introvert, who is not able to speak, who is not doing his homework properly, who is continuously fighting with his friends or with his classmates, is aggressive, when such kind of abnormalities are observed, the teachers should take proper steps to observe it, to report it to the parents or to report it to the higher authorities, so that such problems can be solved. And yes, the teachers must develop the trust among the students, because the students, especially at the tender age, they're very close to their teachers. The teachers have a great impact on them. So if such kind of problems, if the children are facing such kind of problems, they can be easily, they should be able to share with the teachers. So then it is very important that the teachers develop trust among the students. So now coming to the few tips for good mental health. First one, obviously, sports and exercise. So it has been seen that nearly 80 to 85% of people recover with the sports, especially the sports. And exercise also nowadays, if you can see, there are in India, there are a number of like yoga classes, yoga dance classes. If we go have exercise, if we have in such a group activities, it will be more effective. And secondly is meditation. Well, meditation, it gives control, like the all the kind of problems that we are having, that is mainly due to the desires. We are not able to control our desires, and so we are facing so much of problems. So meditation is something which helps to control ourselves. Well, it is good for mental health, but if there is a person who already has a mental disorder and who is already in a severe state, such people are not recommended for meditation. But meditation, if you want to develop, then third one, connect with nature. Yes, we prefer going to places Instead of that, if you, as parents, if you take our children to to places like a ride in a jungle, or some near the seashore, or some river at your place, they let them connect to the nature, because connecting with the nature is a health and physical, psychological, and physiological development of people. And then when you go anywhere, try to collect memories and not pictures, because what is being seen nowadays, yes, we go out, the parents take their children for outing and all, but we are spending time in clicking the pictures. Like a few months ago, I just went to Agra, and I was seeing the Taj Mahal. I saw like nearly to 70 to 80% youth, they didn't even enter the Taj Mahal. They were just standing outside, clicking pictures, making videos, and all nearly for 2 hours they were doing the same. So, okay, click pictures is not bad, but try to collect memories. The place where you go, try to know more about it. Try to explore that place rather than wasting your time on collecting pictures or making pictures. Then, having a proper and balanced diet is very necessary. Sometimes it is thought that you should be having a different kind of diet if you want to have a good physique, and you need a different diet, a kind of diet, if you want to be mentally strong. Well, it is not the case. Just a proper and balanced diet at the right time, choosing the right kind of food, avoiding the fast food. So this is all you need, because it is again the digestion process, which sometimes it says that the scientists mostly say that when you get up in the morning, if within 20 minutes, if you're not emptying your bowels, means that can lead to illness. Yes, it leads not only to physical illness, but in the meantime, when it is not taken care of, it can also lead to mental illness. And of course, good sleep. And like I was talking about the sleep disorder. So the people with the mental illness, actually sometimes we think that they are not able to sleep properly during the night. But in some cases, there are people who sleep for a longer periods. So even keeping a track of the sleep is again very important. But like we have been learning right from the childhood, early to bed and early to rise makes a man healthy, wealthy, and wise. So this is something that has to be followed. And last and the most important thing, we need to purify our hearts, because we every day we have been accumulating so much of things in our heart. Everything that we see, every word that we hear, it makes an impression on our heart. And the but when we accumulate negative things in our heart, negativity, enmity, jealousy, and all these negative thoughts, they are like a poison. A person who consumes poison dies. Similarly, this poison of negativity that we accumulate in our heart, it does not affect the other person. You may be feeling jealous of someone. You must be having negative thoughts about some other person, but this poison is not going to affect that person, but it is going to affect you. And these are the feelings of the hearts that are converted into thoughts. So this is again very essential that you purify your hearts. And this is what I had to say. And before leaving, I would just like to say that it is, when we talk of mental illness, suicide is the last step which a person takes sometimes. And it is very painful for a parent to see his child leaving the world in front of him. The death can be due to many other reasons. But when the death is due to suicide, it is very painful, because the parent keeps on thinking, why? Where did he go wrong? And in most of the suicide cases, sometimes the reason is unknown. So please take care of the mental health and come up and speak about this mental health, so that the people become aware. The lack of services, lack of awareness that is existing in the society regarding mental health, that has to be removed. And once again, thankful to IDYM for such a wonderful topic of discussion, so that many people can come and share their views, and somewhere we will be able to deal with this problem. Thank you very much.
Thank you, Anjum ma'am, for putting up beautifully all your views, and which are practically actually yes for that, and I really agree with that. As you said, eating right, and this is what we have discussed yesterday, Dr. Imam and Dr. Melissa also discussed yesterday, eating proper diet.
Yeah.
This is really a very important problem in today's world. And yes, the topic that you have touched in the last point was suicide. It's very painful. Yes, as working as an educator, working as a school principal, me also, when I have seen people, students who are committing suicide, just for simple reason they cannot take stress, and that stress is caused by us, especially the parents, the society where we live in, where we are forcing our children to, bring that much of mark percentage. We are forcing them, we are giving them that of mental stress, where even I believe we are a part of that, you know, um, decorum, where we are forcing that you have to, you have to clear this exam. It is an IIT, it is a CIT, or it's an,
Yeah.
JEE exam. So we are only forcing the children that you are a good student, but end of the day, what we are doing, we are giving them mental illness. So yes, I do feel sad about that. And with this, seriously, people who are, especially my children who are watching, live here, take this note. Life is very precious.
Yeah,
It,
ma'am.
it is only once that you get life, so don't lose it. You will get stressed. We are getting stressed till now. So it is, life is not without stress. You need to know how to deal with it. Talk to people.
Yeah.
See how many people have spoken yesterday and today also. And see, ma'am, you have also spoken. Speak to them. Even Pratik sir has spoken, and Rana ma'am has also spoken. We have to speak. We have to open up. Unless and until you don't open up, you cannot, come to solutions. Maybe solution is not there with you. Once you share your problems, solution may come out from somebody else.
Yeah, ma'am. That is true. That is
Yes.
very true.
Thank you so much, Anjum ma'am, for bringing up
Thank you, ma'am.
point of views and explaining in so much of detail. Thank you so
ma'am.
much, Anjum.
Thank you, ma'am.
With this, I would like to call our favorite Bedkar sir before we, wind up for the day. Bedkar sir, if you have any point of view to share, please, sir. Bedkar sir, if you're there.
Yes, he is there, but his mic is closed now, and his video also.
Good evening,
Yes.
Madam Meenakshi, Madam, Dr. Iman, Madam, all the resource persons. And today I have also listened to all the Nobel resource persons, and topic was related to biological aspects of our body, that is brain. I am not biology teacher, so I can't scientifically elaborate all these things. But the brain related disease or disorders, if happened in our body, the reasons may be genetic or maybe some atmosphere or surrounding. So to keep a healthy brain, healthy mind, we have to adopt the Indian culture like yoga, meditation, away from the stress, keeping happy with us, with ourselves. So all these things are required to keep our brain normal and happy, because always the circumstances, if they are highly stressable, they always cause the effect on the body, that is brain. It ultimately causes on the or other organs. So that we have to keep our body healthy with happy atmosphere and with all the habits which we can enjoy all these things and keep away ourselves from the stress. And if they are the genetic or other thing, they can be treated with the expert doctor. It's a best topic, because either we are educator, so that the students which are in front of us, they should not be stressed more than their capacity. They should be given a treatment, healthy treatment, happy treatment to all. And with this, I would like to thank to all the Ravi Shankar sir, Rajput sir, all the technical team, all the resource persons, by introducing new and new topics for us to learn more and more from the renowned resource person from India and abroad. And congratulations to Meenakshi Madam as a host and co-host Dr. Iman Madam. Congratulations to both of you. I will try to join every day to listen from you. Thank you. Thank you.
It's very grateful of you that you recognize each and every event and you put your point of views to us. So thank you very much, Bedka sir. I would like to invite anybody who would like to speak on this topic. Any speaker who would like to speak? Anyone who?
We have Rashna ma'am. Rashna ma'am.
Ma'am, if you are there, if you would like to speak, ma'am.
Yes, she is with us.
Yeah, good evening, good evening. Am I audible?
Yes, ma'am.
ma'am.
Yeah, it was a wonderful session. Meenakshi ma'am, you were amazing the way you coordinated. And I really enjoy because this right now is mental health is the greatest factor which we need to work
Ma'am,
on.
if you can open your video. If you can't, it's okay. If you can, please.
I know video actually. I was today prepared to only listen. So I didn't want.
Okay. Don't worry. Just I wanted to spotlight you. So go ahead, please.
Yeah, so just I wanted to share a few points that yes, mental health is right now the need of an hour, and we all need to keep the mental peace because without mental peace, nothing is possible nowadays. We have a lot of problems coming in because of this mental illness. So it is very very poignant from all of us, as Dr. Pratik had also discussed, and Meenakshi ma'am has also added some pointers that yes, we need to keep the situations very normal, grounded, without making it very challenging for anyone, so that it becomes totally uncomfortable for them to answer any questions at any point. We need to make every situation completely reasonably fine with everyone. So that is what is the main necessity. And when we are talking about the biology of mental illness, we come deeper into the topic, which already was discussed by the eminent speakers today. So I won't delve more into it. But mainly, we see that the main biological basis of mental illness is anxiety and depressions. If these two things, anxiety and depressions, can be removed, then I think we can make a better future for our students and even for the children who are undergoing this stress. There are many people who are into this concept that there has been a lot of changes coming around and they're not able to take that change positively. They're under some pressure which has to be rooted out by us as mentors. And this can be very, very nicely done with the experience and giving some opening for them to outbox themselves without being judged by others. Give them a non-judgmental platform. Never put them into the judging scene. So if they feel that they have been judged, then they will never open up. And as a result, they will be under stress, anxiety, and finally into depression. So that is the biology of the mental stress or the mental illness, which we can say. And Dr. Pratik gave some very good rules, and Dr. Anjum had very nicely shown with a presentation also the different pointers, which is very necessary. I really loved the presentation of Dr. Anjum, where she had shown very clearly the pointers which is needed right now from the child's point of view. We always make fun of the kids, and the kids, when they go back home, they don't open up, they don't want to share. And that is where we are missing out the connectivity. We need to join the dots now, where they are leaving out and then bring out that complete change which we desire to see. So it was a wonderful session. I thoroughly enjoyed. But yes, little bit I'm not keeping well. So the last few days I'm not able to join. But of course, I want to thank IDYM platform and Meenakshi ma'am and Iman ma'am is always the pillars of IDYM, hosting such wonderful sessions, and all the time knowledge takeaways are there. So it's wonderful to join anytime. Whenever I get time, I just join and enjoy the sessions. Thank you so much for inviting me to speak, Iman ma'am, and Meenakshi ma'am. You're amazing.
Thank you so much, Rachna ma'am, for putting, giving such a good. Seriously, these, as you said, the puzzle pieces are missing. This is what we are missing today when children come home. And I totally agree with you. 110% I agree with you that this is when students come home, they don't speak. We just let go. We just ignore. We just, because we are into our own world, we are focusing in our work. We don't focus on the children. And that is what it is becoming a gap. And that is what it is leading to the biological, mental illness in students, which is like now it is 43.26% worldwide, including India, where the maximum people are mentally stressed out and illness. And all that range comes from 16 to 20 years of the tender age where children more of mental illness. So again, thank you, Rachna ma'am, for taking out time and sharing your inputs. Thank you, ma'am, for joining and helping me out today. Vedka sir, thank you so much. Pratik sir, thank you, and Raina ma'am and Anju ma'am, thank you so much, everybody, for coming up and discussing this vast topic, which was very much required today, and the knowledge that you have all have shared today. I hope everybody who has seen this or who are going to see this are going to gain a lot of knowledge with this. With this, I would like to thank everybody, including IDYM group of companies, for bringing such different programs where we learn a lot. One series end and the another series is already ready for the go. So we are unstoppable. We are going. We are learning non-stoppably. So thank you, Ravi sir. Thank you, Jeanat ma'am, and thank you, my dear lovable Dinul, who is always there to support me when I need the most. So thank you, everybody, for joining me today on mental illness series 2. See you again soon, and thank you, and have a great night. Good night,
Yes.
everybody.
Thank you, my dear sister. Sorry for the delay because, as you know, the time difference. I'm running to join because I appreciate the series of IDYM. Can you hear me?
Yes.
Okay, but just I wanted to add one point. If we can understand the biology of any illness or any problem, we can appreciate and respect the issue, and also we can detect the suitable diet and food. We can detect also how can we deal with the patient. It's very important because we need to know what is the biology of mental illness to deal with it in a perfect way or high performance. Also, thanks a lot for choosing this lovely topic. Really, as you said, all of us are in appreciation to IDYM because non-stoppable series. And thanks for your efforts. Sorry for leaving you for a part of time alone today. I'm so sorry, but I don't like to leave you. Forgive me because already you know time difference and this issue. Appreciation to all of you. And we can't ignore the issue of biology of mental illness because it will affect on diet, affect on dealing with the patient at all. Thanks a lot for all of you.
Thank you. Thank you. Thank you, everybody.
Most welcome. Most
Thank you.
welcome. Bye bye.